Well, let's hear what a few more patients with heart failure have to say.
Well, the first thing I do is I weigh myself, just to check my weight, to make sure that I haven't increased. Or if I do put on extra weight, I normally know that there's fluid gathering there.
If my weight has increased, I tell my doctor or my heart failure nurse. They get me to take another tablet for maybe a couple of days. That gets my weight back down to normal.
My breathing at night, sometimes if I'm lying too flat in my bed, I find it restricts my breathing and it causes me to panic a wee bit, so usually I have to get myself extra pillows and sleep more upright, and it makes my breathing a lot better.
I look after myself. I get the flu jag once a year in the autumn, and I try to get out as much as I can.
You've got to pace yourself, yeah. As I said before, your body knows your limitations. It tells you when to stop.
I get a lot of blood tests. I actually feel like a pincushion. I go to see the hospital doctor once every 3 months, and I usually see my GP once every 2 months, and I see the nurse at the GP's usually once every 2 weeks.
The tablets help tremendously. I've one of these wee containers with 4 different compartments for the day, which reminds you what to take when. I'm careful about what I eat. I've cut right down on how much salt I use in cooking, and I avoid things like crisps, bacon and sausages. And of course, I try and eat more vegetables and stick to a healthy low-fat diet as far as possible.
I had hobbies that I used to like playing golf, go to the football and that, but I'm afraid they're too much exercise for me to do now, so basically my only hobby now is maybe trying to take short walks somewhere. But it's as I say, you can't go too far. It's not only the getting there, it's the getting back.
I know some people get depressed. My doctor has suggested antidepressants to help me cope if I get down, but I'm lucky. My friends and family are there for me, and I'm getting better at asking them to do things I can't manage.
I play a lot of bowls, I do a lot of fishing. I used to play a lot of golf from home to start playing again, because I'm feeling an awful lot better.
So, to recap, report changes in your symptoms to your nurse or doctor as soon as possible. Monitor your weight daily and report sudden increases. Take your medicines as directed. Reduce salt intake. Speak to your nurse or doctor about how much fluid you drink in a day. Stop smoking and keep as active as possible.
Well, thanks, Janet. That was really interesting and very useful. So you take care now.
Okay then, bye Tom.
Bye now. The fact is that while heart failure can't be cured, it is possible to improve the quality of life. It's a condition that needs constant monitoring, and any drug treatment has to be well controlled. But the heart failure nurses can be a great help with this. And the Chest, Heart and Stroke Advice Line is a good source of information, and anything you want to know about heart failure is in a booklet called Living with Heart Failure. So thanks for watching, and go on, enjoy your life.